Hello friends, today we're going to discuss about dyslexia. I'm Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMANS, Bangalore. In this video, I'll be discussing about dyslexia, what are the signs and symptoms, what are the assessment and management of dyslexia. Dyslexia is a commonest specific learning disorder. Specific learning disorder is an umbrella term for neurodevelopmental disorders that are typically diagnosed during the early childhood. Unfortunately, in developing countries, it will be recognized either in the adolescent or in the early adulthood. These SLDs are characterized by impairment. That impairment should be persistent in at least one of the following. That is reading, dyslexia, writing expression, dysgraphia, mathematics, that is dyscalculia, or mixture of above. Dyslexia is one of the commonest specific learning disorders. Specific learning disorder in which the normal patterns of skill acquisitions are disturbed from the early stages of development. As I mentioned, they have been diagnosed, and also the diagnostic system recognizes only three of them: dyslexia, dysgraphia, and dyscalculia. In this video, as I'm discussing about dyslexia, let's understand about dyslexia. It is difficulty in acquiring and processing language that is typically manifested by the lack or proficiency in reading, spelling, and writing. When you are unable to read, sometimes it is very difficult to comprehend and write also. Persons with dyslexia often has difficulty in reading due to the problems in identifying speech sounds and learning how they relate to the letters or the alphabets and words, that is decoding. They also have difficulty in comprehending what they have read. This summarizes about dyslexia. Dyslexia is a result of individual differences or difficulty in the coordination in various areas of the brain that process language. Dyslexia is not due to the problem of intelligence, hearing, or vision. It is an independent, specific learning disorder. Here, there are various studies which have looked into the cognitive process of a person suffering from dyslexia. Here, there is a difficulty in phonological awareness, verbal memory, and verbal processing speed. So these are the issues with regard to cognitive problems in dyslexia. Let's look into the types of dyslexia various people have classified and categorized the dyslexia. The commonest one is this: phonological, that is auditory dyslexia. Here, difficulty in processing the sounds of the individual letters and syllables and cannot match them with the written forms. Suppose a person has to identify A. Now, he has to process that, store it. Whenever he sees it next time or hears it, he should be able to associate the auditory information along with the memory of A, how it is written. So there, the expression of phonology or auditory plays a role. Moving to the surface dyslexia or visual dyslexia. Here, difficulty in recognizing the whole words, which probably results from vision issues or visual processing difficulties in the brain. With trouble recognizing these words, these people may have hard time learning and memorizing words. Here, by seeing and reading is a difficult issue. Rapid naming deficit. The person finds it difficult to name a letter, number, color, or object quickly and automatically. The processing speed is very low and it takes time to name them. Many a time, these children take 3 to 4 times the time which is required for normal people. The fourth one is double deficit dyslexia. The person with double deficit dyslexia shows deficit in both the phonological process and naming speed. The majority of the weakest readers all fall under this category, that is double deficit dyslexia. Let's understand the process of dyslexia and how we read and learn to read, at the same time understand. Here, we need to understand the phonological awareness. That is, the ability to recognize and manipulate the spoken parts of sentence and words. Here, the first and the foremost, ability to identify the words that rhyme, recognizing alteration, segmenting a sentence into words, identifying the syllables in a word, blending and segmenting onset rhymes. So these are the various important cognitive processes or phonological awareness a child should learn so that he is able to read and write over a period of time. Let's understand by this diagram. Phonological awareness is an umbrella term where phonemic awareness is one of the subunit of phonological awareness. As I mentioned earlier, in phonological awareness, rhyming, alliteration, identifying syllables, and coming to phonemic awareness, here the child should be able to segmenting, blending the words, manipulating the sounds so that it can be utilized for reading. So this whole thing will be considered as phonological awareness, and the subunit is phonemic awareness. Phonemic awareness includes ability to hear and manipulate the individual phonemes. Emphasis is paid on phonemes here, which is the smallest unit of speech. Example, K in kit, B in bat. That means to form a word, the first letter, which is, for example, in the bat, B, here the person should be able to learn, store it, process it, and learn to write it also. So whenever he hears bat, the B should be recognized immediately and is able to process it. And the complete word bat, A-T, also should be able to retrieve it and process it and write it. So the whole phenomena will be considered as phonemic awareness. It is the ability to notice, think about, and work with the individual sounds in spoken words, phonemes. Here, once a person becomes able to read, write, and over a period of time, the brain works automatically. You need not read every single alphabets like B, A, T. Suppose a person has dyslexia, he needs to read individual syllabus and then he will form BAT. That means reading is a mammoth task for them. Let's look into the symptoms of dyslexia. First and the foremost, delayed speech development. Suppose the child does not able to read, speak over a period of time, maybe 3 to 4 years, immediately the parents need to take help, seek professional help. Difficulty in memorizing letters and colors. Invariably, the child, by the end of 3 years, it should be able to learn some alphabet letters and naming the colors. Choosing wrong words. In spite of training, if the child continues to have this problem, then you need to seek professional help. Reverse sound. The child, instead of learning, and if in spite of learning, it reverses the sounds. Difficulty in learning new word. Here, the learning, that means the child takes longer time to learn compared to normal children. Difficulty in pronouncing new words. In the absence of any physical deficits such as tongue tie or else speech problem. Confusing between words that sound similar. That means the child identification of those alphabets along with the sound gets confused. Reading difficulty, struggling to write those words, struggling to write the sentences completely, unable to appreciate the complexities of the language rules. That means the child, although may learn how to read, but however, it finds it difficult to understand the rules and regulations to use the language. Difficulty in processing information which is printed. Difficulty in memorizing things in a sequential order. That means the child should learn in a chronological order, place them, and able to retrieve. Trouble in processing the words with similar sounds. Avoiding involving the task of reading. This is a classical presentation in the classroom. The child refuses to read because it is worried that the children, his peers, and the teacher may make fun of him. And this leads to poor academic performance. Since they avoid reading, there is no practice. If they don't practice, they need to form memories. Those memories are not formed, and there is a further academic decline. And it gets into a cascading effect, and the dyslexia will lead to dysgraphia, dyscalculia, and academic dropout. Struggling with various spellings, mispronouncing words, alphabets, difficulty in memorizing text, difficulty in reading aloud, difficulty in conveying a story, or else summarizing a story. That means the child finds it difficult to comprehend. That is, when they may read fluently, but they do not understand it. That means there is a disconnection. That means the motor area of speech is good, but however, the comprehension has a problem. Difficulty in finding the right words or answer to the questions. Difficulty in seeing or hearing similarities and differences in letters and words is the commonest problem the early adolescent children will have. Taking 2 to 4 times as much as time required for other children to do the same task of reading. That is a classical presentation in dyslexia. The Charles talked about stages of reading model. First and the foremost, the child needs to learn how to read. That means a reading as a physical entity. That means it's just a mechanical process initially. But later, reading to learn. That means the child now, once it learns to read, now it should understand what it is read it, and it is able to, should learn how to express that. That means learning to read first and reading to learn. That complete loop is very essential for the child to grow in this society. Learning to read is decoding. That is, if there is inaccurate word identification or else pronunciation, storing, or it is very slow and effortful, that means the child is going through a difficult phase. Need to reread is another important criteria which has been starting from the childhood. Next comes is comprehension. That is reading to learn. That means here the child has learned how to read. Now it has to learn by comprehending it. Reading comprehension, or else unable to understand the rules of grammar, spelling, punctuation, sentence formation, and language. So these are the very essential component of dyslexia. Let's look into the prevalence. How many children have this dyslexia? Various studies across the world have clearly said that it varies somewhere between 5 to 10%. In India, various studies have said it is 8%. And the recent meta analysis also talks about 8%. That means at this point of time, we have 1.5 to 3 crore children having SLD. That is not a small number, it's a huge number. And that means we have a huge responsibility to identify them, place accommodation measures, modification measures, at the same time, remedial measures. But however, the problem is much more bigger than that. As I mentioned, 1 in 10 have dyslexia. That is 10%. Unfortunately, 1 in 20 are people with dyslexia are identified. That means our recognizing capacity is only 5%. Out of 100 dyslexia patients, the patients who are diagnosed is only 5%. In that 5%, how many of them get remedial measures, accommodation, and modification? No studies have looked into this. That means the treatment gap is huge. Diagnosis gap is huge. We are not doing justice to our children. That we need to understand. Let's look into the comorbidity. If we don't identify these children with dyslexia and comorbidity, we are going towards a disaster. Dyslexia is associated with other difficulties such as dysgraphia and dyscalculia. The child first need to read, then only it will be able to write and later calculation. Dyslexia as a comorbid condition with depression, anxiety, internalizing behaviors, externalizing behaviors. Not only that, they are severely affected by rejection, rejection by their own parents, telling that you are useless, not good for anything, you are lazy, you are procrastinator, trouble creator, and the society rejects them. Think about these children. What will happen to them? Not only that, the recent literature talks about SLD and suicide, suicidal attempt. And it has been said 3 times more commoner in children with SLD compared to children without SLD. The other comorbidities are school refusal, dropout, truancy, running away from home, challenging behavior, delinquent behavior, drug abuse, substance use, sibling rivalry, ADHD, that is attention deficit hyperactivity disorder, oppositional defiant disorder, conduct disorder, and many other disorders will be developing over a period of time. Now let's understand the neurobiology of dyslexia. And to understand neurobiology, one need to know that reading is a complex cognitive task that requires identification, integration, and communication across various regions of the brain and generally happens with greater automaticity. That means once the child learns over a period of time, by looking at the word, the child should be able to identify and read the sentences. The network of left hemisphere of the brain are crucial for reading, such as left inferior frontal region, the dorsal temporoparietal region, and the ventral occipital temporal regions, especially in children with right hand. That means the reading will happen usually in the left hemisphere of the lobe. Let's look into this diagram. In this figure, you can see the normal children have 3 important parts of the brain which are active during reading. That is Broca's area, that is in the frontal lobe, where motor speech area, which is present there. Another important is parieto-temporal area, that is comprehension. And the next one is occipito-temporal area. In normal children, all these 3 areas gets activated when they read. But in children with dyslexia, the overcompensation occurs in Broca's area, but unfortunately, the parieto-temporal area and occipito-temporal area do not get activated. That means they have some problem in the brain. Invariably, it occurs during the development of the brain, or else it may be genetic in nature. That means we need to blame the brain fault, that is neurodevelopmental. Blame those neurons, not the child. Unfortunately, since there is a problem in the neuron, or else neuronal pruning, or neuronal migration, or neuronal plasticity, we will blame the child. We isolate the child. Our society thinks a person who reads is intelligent. The person who has SLD is good for nothing. That is the way we outcast these children. You ask me, by doing this, stigma and discrimination of children with specific learning disorder is a crime. We are pushing them to the corner. That should not happen in a welfare society. So, one need to understand, we should not blame the child. We should blame the neurodevelopmental brain and to see how we can accommodate these children. How can we do modification in the society? At the same time, is there any remedial measures that need to be taken into task? Let's look into the dysfunctional network hypothesis. What happens in the brain? There are 3 important things which have been hypothesized. First is resting state networks. That means dense interconnected modules have been noted in the brain. Next, the hub areas, which connects these resting networks. That means there is a hub centers and also resting state networks which connects these hubs. Unable to integrate the information across different hubs, that is the region with resting state networks and which connects these resting networks. If there is a disruption or difficulty in coordination, This leads to specific learning disorder, especially dyslexia. That means there is abnormal functioning of the hub region that connects information between different systems and resting state networks. That means communication is a problem, coordination between these hubs is a problem that leads to dyslexia. If you look at the neurodevelopmental hypothesis, abnormal neural migration during the development of brain and also dysfunctional pruning can lead to dyslexia. Only that. Abnormal neuronal plasticity also has been considered, or else decreased neuronal plasticity or reduction in neuronal plasticity, especially in the left hemisphere, has been considered for SLD and dyslexia. Reduced gray matter and cortical thickness in the perisylvine area have been also noted in dyslexia. Hypoactivation, that means during reading, there are certain areas which do not get highlighted or they are not active. Hypoactivation in left temporoparietal and occipitotemporal region, which I had shown in the figure. And the fifth one is morphological changes are seen in corpus callosum. That means the connection between the two hemisphere, there is a issue. fMRI, pre and post intervention studies have implicated left thalamus, that is basically the sensory relay station, left middle occipital gyri, bilateral inferior frontal gyri, right insula, and right posterior cingulate gyrus have been implicated in dyslexia. Let's look into the management of dyslexia. Dyslexia is a chronic condition. It is a neurodevelopmental disorder which spans over lifespan. That means, although we say we are able to do remedial measures, but you cannot cure. Here, we are able to adapt the child, modify the environment by applying remedial measures. We are able to adapt the children to the requirement of the society. And once the child has been referred, you need to know the reason for consultation, timing of consultation, and what they expect from this consultation. And when you start the consultation, please try to take the teacher's report, ask the family members or the parents to bring the child's notes, exams or test, writing material or answer sheets, and see how the child is performing. At the same time, you need to also give certain homework, look for the child's habit, and also do a detailed evaluation of the child to look into the comorbidity. And essentially, as I mentioned, especially in specific learning disorder, comorbidity is the rule. 70% of the children will have one more diagnosable psychiatric condition. Look for the past, personal and family history, especially developmental history, need to be taken with caution. Look for anxiety, depression, internalizing or externalizing behavior, substance use, ODD, conduct disorder need to be checked. And also, by clinical assessment, check for, especially is there any global delay in milestones and intelligence is there, please check that. If the family is very clear, the child is very brilliant, very sharp, but it is very poor in academics, that indicates we are dealing with SLD. Assessment can be without time limit initially and followed by placing some time limits can be done. Test to be done usually in the morning, not in the afternoon when the child is tired. And the assessment should be done in multiple settings. And if possible, if you want to do in one or two settings, please have breakout session based upon the child's need. Don't force the child to undergo assessment. Before you do assessment, please do take consent from the parents or else from the legal guardian. Diagnosis of reading ability should be covering the speed, accuracy, and comprehension when the child reads. They should not score more than 10 to 20%. That is, you need to define before in hand, is it 2 standard deviation or 1.5 standard deviation is the limit you are placing of the same level of class or standard. That needs to be taken into consideration. Once the child is performing very low, move one class below the consecutive order to see at what level the child is stuck or the child's reading skills have been arrested. Formal assessment to be attempted after reasonable degree of accommodation and reasonable degree of measures have been taken at least for 6 months. That means if the child comes for today for consultation, at least once you have done the assessment, we have checked for the comorbidity, you have treated the comorbidities. Now you need to do at least a reasonable degree of remedial measure over a period of 6 months to differentiate between whether the child has specific learning difficulties versus a neurodevelopmental disorder which is lifelong. The remedial measures which can be attempted before we go to SLD assessment is extra classes, home-based intervention by parents, peers, and friends can be attempted. Pervasive symptoms to be present, that is, reasonable degree of attempt for remedial measures should have been failed for at least for 6 months. That means it should be persistent, it should be pervasive, it is not dependent upon the environment. And you need to make awareness to the parents, that is, educating the parents and teachers about the child's weakness and strength need to be highlighted. And you need to make sure the child is not discriminated, criticized, beaten up, isolated, or else removed from one school to another school. Decreasing the expectation of the parents and also the child by himself needs to be decreased. Treating the comorbidity symptoms like depression, ADHD, and substance use should be the priority before you do SLD assessment. And we need, once the assessment is done, we need to do certain accommodating measures. Allow access to study materials. The child may not be able to write the notes, so we have to provide notes to the child. Using digital technology to teach, maybe grammar check, recording the classes, audio, those are the things we need to do. Repetition of classes, repetition of instruction, slow pace of learning, visual prompts, separate classes, frequent breaks, text to speech should be considered for a child who has dyslexia. Further, we need to do modify, that is modification. Expectation from the child should be modified. That means don't expect the child will score 98. Please don't do that. You yourself or a person who has been a first rank holder may not be able to score consistently 98%. If he does, very fine. But he's the first rank holder. Don't compare the child with other children or even with his own siblings. Don't do that. That's a crime. So modify the syllabus. And the child is unable to write or read, please start oral assignments, oral examination, more times to be given. That means extended period in the exams to be considered, exemption from certain subjects should be considered, modifying the curriculum for these children, and we need to implement national education policy in the true spirit. Remedial measures, especially most children with dyslexia, can succeed in school with tutoring or specialized education program. Emotional support is very, very essential. Without that, the child will be deleted from the system. You are throwing the child away from the society. That should not happen. Remedial measures like intensive training once or twice a week for the next 1 to 2 years with the professional help should be done. And programs, let's read a program at home based, should be started at the earliest. Here, the language support with reading allowed together encourages the child about the knowledge of alphabets in children. For example, if the child finds it difficult to see and read, you can even give brailleys. That means multisensory. If the way the child who is blind will touch the braille or the text and learn, similar method should be adopted. Similarly, reading aloud because the child finds it difficult to integrate those printed text in such a scenario. The parents or somebody else along with the child should read. And these activities should be carried for at least 15 minutes per day. At times, frequent intervals of 15 minutes can be considered. And also, teaching can be taking various other forms such as games, maybe loving rhymes, recognition, creation, syllables, knowledge of words, sentence recognition. So, various ways should be taken and considered in a creative way with regard to remedial measures of dyslexia. There is not one solution. All children are unique. They have a different genetic background, family background, economic background, and cultural background. So you cannot have one simple standard remedial measures. Each child needs to be tailored for their requirement. That means your remedial measure should fit the child's need. It's not that push the child for your standard format of remedial measures. Intensive training or teaching should be considered. It should be explicit, completed by a tutor or a reading specialist, preferably occurring in small group, not more than 2 to 3 children. And if you are able to hire a tutor or maybe a special educator, one-on-one is the best. Here, you need to focus more on the skills. And when you start teaching them, it is a graded systematically in a micrograins, in a sequential order should be attempted. Don't flood the child. And also include multisensory approaches for teaching, not just visual. Focus and reinforce microgain, not to lose patience, especially the parents. And you need to also provide phonemic awareness activities, such as isolation, the training in recognition of the individual sound in the words. For example, what is the first letter of cat? The child should be able to recognize C. However, many a time the child may not be able to understand cat means they may say K. But English is a very funny language, difficult language, and SLD is more in English language. If the child is from having the mother tongue is English, it's well and good. But however, SLD is a problem in the brain. They are unable to understand the rules and regulation, how cat is CAT, not KAT. Those things the child need to understand the rules and regulation of the society which has been placed on this language. Identity, ability to distinguish the common sounds in differing words. For example, the cat and cot. It should be able to differentiate. What is the difference? A is the difference in comparing cat and cot. That should be able to, the child should be able to understand that. Substitution, replacing one phenome for the another to create a new word. Rat for cat, sad for bat. So similarly, the child is able to replace certain words and able to come up with these words. Segmenting, it is able to break the word into different sounds. For example, Raja, it should be able to differentiate and produce different words. Pronunciation RAJ, Raja. That segmenting is able to do and able to consider and comprehend it. Blending is joining the sounds to form a word. RUN, run. So the child is able to understand. Run means comprehending it and doing the activity. There may be considered for intensive training. Each session will last for 30 to 45 minutes. It is dependent upon the child, not on the session who is going to be given by the therapist. Because it is not the speed at you teach, it is the speed at which the child learns. That should be the determining factor. It may be 2 to 3 sessions per week, and these sessions will last for 2 to 3 years. Be patient. The child has a weak brain or that brain which is not suited for our society. So be patient. Don't blame the child. The brain which has been suited for something else, we are forcing that brain to work in a different environment. Intensive individual in a small group training should be attempted. 2 to 3 children should be considered. If you have no problem in the budget or economy, consider individual. Multisensory modality should be considered. Specialized training educators should be there available for this intensive training and remedial measures. What are the future directions? Massive awareness program should be done with regard to specific learning disorder. Teachers, policymakers, educators, parents, and the society at large should know what is specific learning disorder. It is not the child, it is the brain. Again, in the brain, the neurons and faulty connection, or maybe developmental delay, or maybe neurodevelopmental problem have been implicated. Screening instruments need to be developed and standardized across all language. Remedial tools, books to be developed. And for that, digital technology should be leveraged, such as metaverse, virtual reality, or augmented reality should be taken help for doing remedial measures. And the policy should be inclusive, should be accommodating, modifying the environment, not forcing the child in a society which is different. human resources to be increased to do this mammoth task of doing identifying, modifying, accommodating, and remedial measure of 1 to 3 crore children. At the same time, we need to implement this Right to Persons with Disability Act of 2016 in the true spirit. Not only that, many health insurance refuse to give this training program for the children with SLD. Please remember, specific learning disorder is a health issue, not only academic issue. It is now a public health issue. Both public and private insurance company need to cover the SLD. There is no hiding because the Mental Health Care Act of 2017 has clearly stated that mental illness cannot be excluded from health insurance. Dyslexia can cost a huge to the society. Intervention needs huge trained human resources. At the same time, accommodation, modification, and remedial measures to be done. Children with SLD who don't receive intervention can be a huge cost to the society, to the family, and for themselves. To conclude, my dear friends, dyslexia is in very high prevalence. It is the commonest SLD. Here, comorbidity is the rule. The treatment includes early detection, early intervention, minimal displacement of the child from the school and the society, extended classes with small group of students involving family members, massive awareness program in the society. At the same time, if there are a severe case, specialist training or professional training should be considered in dyslexia. Thank you very much for giving your valuable time. Stay safe.